Hi there, I'm Dr. Adriana Potter, and the Don't Let Pain Drive You Insane series. We're going to talk about heat versus cold, when to use it, and what the benefits of using it, and the contraindications, what are also the bad thing of using one or the other. So that way, after the end of the video today, you will be more informed on which one might be best for your condition. Okay, so let's get started. Use cold packs or to use a hot pack. Okay, well, first of all, let's just talk about a little bit what does each one of them do. Okay, so if you're picking a heat, what does the heat will do in your body? It will help to increase circulation. It will help decrease the muscle spasm, because with that increased circulation will remove lactic acid or waste product more easily. It can help in the expediting healing. It will also help to increase oxygen perfusion in the area, which means bringing more oxygen to the area that are in spasm, so that will help the muscles to relax, because sometimes you can get the spasm because there's too much restrictions on the area. And usually indicated for people with chronic pain, but sometimes you can also, we'll talk about a little bit when you should use the heat or the cold. But in general, anything that creates a hot thermal sensation, it will help with these things, decreasing the pain, increasing circulation, making muscles and joint less painful, and moving more. Okay. The cons of using the heat is that if you're already having some swelling, you're going to increase that swelling more. So that would be, don't use any heat if you're having any swelling. If you're having hypermobility in your joints because you're either pregnant, have EDS or HSD, your joints are too loose, that heat will make your joints even more loose. This will create more joint laxity because the thermal sensation make everything more pliable. You also have to be more careful that also with the heat, if you're doing a submersion in heat, like a hot bath, that will decrease your blood pressure, will increase your heart rate, and that can be bad for patients that have issues with blood pressure, like patients with POTS. So you have to be careful. It doesn't mean you can't use it. You just have to make sure that you're using and monitoring your vitals, so you don't have issues with your blood pressure going down too fast or having heart palpitations. Or if you're having heart palpitations, at least you know it's because it's a side effect from that increased oxygen and blood flow to the body because of the bath submersion. Okay. Make sure that you time using the heat usually before exercises, because it makes everything more loose. If you're having like a stiff joint, you want to do the heat before you do the exercises, so it makes easier for you to do, because the joint stiffness you're going to try to move is going to create pain. When you put the heat, you don't have the stiffness, so you don't have the pain with the movement. So what you're looking for as an outcome matters why you decided to use heat or cold. So if you want to be able to have less pain with movement, because when you're moving you have pain, you do the heat and you may find out that, oh, I can move more easily, and you also have less pain when you're doing it. Okay. Alrighty. Now we're going to talk about the cold. So when you apply cold, right, that will decrease circulation. The heat increases the circulation, the cold decreases the circulation. The way that circulation is changed, right, with the heat, with increasing it, is because there's a vasodilation, which means your blood vessels will get larger, so it makes it easier for the blood to flow. With the cold, there is a vasoconstriction, which means there's a narrowing of your blood vessels, and that will decrease the blood flow to the area. Okay, and so if you're having swelling or a lot of inflammation, the cold is better because it will decrease that swelling or prevent from getting worse because of the vasoconstrictions. It will also help with the pain because it will numb out the nerve endings on your area that you apply the cold, and then you're gonna feel less of that pain because of the numbing effect of the nerve endings. Okay. Usually what you're doing the cold is because you have an acute injury. an acute pain because of an injury, or you overworked your muscle, so you have a lot of swelling and you want to prevent from things getting out of control. So you want to do that from the sudden onset of pain, which is considered as an acute pain, pain that lasts less than 3 months. The cold, it will help you to decrease a little bit of that pain and inflammation and help you with recovering and healing a little bit more. In general, when you apply cold to the area, it takes about 7 minutes to numb out the skin. When the skin is numb, those nerve endings are numb, your pain will be less. But you have to make sure to use a barrier between the cold pack and your skin so you don't get a frostbite. Because if you get a frostbite, you're going to get an open wound and a rash, and then you won't be able to do any of this pain management for your area. So make sure to protect your skin from that intense cold. You can also do cold bath, which will it will kind of create a little bit of that heart palpitations, and you can also decrease the blood pressure. So be careful about what the thermal effects, heat or cold, would have into your blood pressure and heart rate. If you're having issues with those, you probably shouldn't be doing any submersion of heat or cold. You should be applying more topical heat or cold. Okay. Now the cons of using the cold usually is that it creates more joint stiffness. So for those people that are very bendy and loose on the joints, the cold may help with that to make you more stiff on your joints because they actually want the stiffness. But the person that have arthritis, whether it's an osteoarthritis, which is arthritis that comes with aging, or a rheumatoid arthritis, which is your immune system that creates that arthritic joint, the cold can make that joint more painful. So, and that might not be good for you, or it may not feel the relief that you're looking for from the cold pack, which means that switch to heat, okay? It's not gonna have any harm. If you have Raynaud's disease, and those that haven't know what I'm talking about, there's a no-no for cold, which means their body cannot tolerate that cold into their skin, and they have issues with the circulation to begin with, which that's one of the restrictions of using cold or heat, is they're having that poor circulation. And Raynaud's is a circulation issue, and so you have to be very careful when using cold. You just had to monitor more closely, doing small bouts of cold and not using cold that is below 32 Fahrenheit. So maybe just a cold compress that is about 40 degrees Fahrenheit versus doing a super frozen ice cold that might not be good for those people. Also make sure that never apply cold when you're having open wounds. That can be a little bit harmful to that tissue that is trying to heal, okay? And remember, the cold will decrease circulation. So if you're already having poor circulation, that's not gonna work for you, okay? I always tell my patients, time your cold and heat properly. Like I said, if you wanna exercise and having a lot of stiffness and pain, you might want to do the heat first. And after you finish, if you wanna calm down and prevent from having any bad side effects from activity and strengthening, you want to use the cold, okay? Make sure to time it also to your bedtime so you can actually sleep more comfortably. Don't let the pain be too high before you start using those thermal applications, whether it's a cold or a heat. By that I mean that if you try to do the cold pack, at the end of the day, when your pain is already 7 or 8 out of 10, you probably had so much pain already to begin with that you're not going to experience the relief of the pain because your pain is already pretty high. So try to do early in the day before your pain gets too aggravated, so that way your body experiences a little bit of calmness and kind of decreasing the pain before the end of the day, and you apply multiple times. There's no right or wrong how many times you could do it. You just have to do it often that you feel like you're benefiting from it. The last thing we're going to talk about, that when do you do a contrast? And the contrast, usually I would say that if you don't have a lot of swelling and you are having that issue with like heat helps but the cold hurts, and so you can kind of do a little bit of that contrast and creating that kind of yo-yo effect into your muscles, which like you put a heat, create a vasoconstriction, soften everything else, and then you apply the cold immediately. and then kind of create a vasoconstriction. So you go into the vasodilation to vasoconstriction, vasodilation to vasoconstriction, and that create a pumping action. So you can actually help the blood flow in different ways and helping with the pain and creating that benefit from it. If you find that you prefer the heat more, so aim the heat into your contrast. So you do like 5 minutes heat, 5 minutes cold, and it finished with 5 minutes heat. And if you like the cold, do the opposite, okay? Hopefully the information about heat versus cold was clarifying about when to use it and what to be careful about it. And if you have any questions, don't forget to put in a comment section so I can address those questions based on your individual needs. I'm Dr. Adriana Potter on physical health. Today we talked about it on the heat and cold, and don't let that pain drive you insane. Series. Keep watching for future videos. So don't forget to subscribe and press the bell button so you can get more information about that pain management. Bye.